It's such a fine pleasure and an honor to be back here doing this every week now. And we started this run. It was a twice a week thing. And the sacrifice we had to make at that time was to jettison another great program which we've managed to bring back on, and the one that helps us profile solutions to our energy problems in this country. And Wiebe has got that back on, for which I congratulate him and say good morning once again to my friend and brother, Wiebe Boer. How are you?
Good morning, Femi. So it seems now today you don't have a jacket on. So how come? Why is that? Last week you were all dressed up.
Well, you fell for the bait. By the way, all through the COVID-19 pandemic, you and I have tried to be as casual as possible.
Yeah, but we're getting more buttoned up now.
Yeah, in the spirit of the lockdown. And then I shocked everybody, and you were thrown on the deep end of the pool last week. So how does revenge feel?
Next week, I'm going to come on with a tux.
All right, guys. Now, the big question we are asking on COVID-19 Heroes this week is, how is the international community supporting Nigeria to fight COVID-19? And we have the smartest man on the planet, perhaps. He won't like that. But to tell us exactly what his organization, a global organization, as global as they come, what they're doing, to support Nigeria to achieve development goals in these times. Wiebe, please do us the honors.
All right. Yes, I will. So this morning we have a great guest, Mohamed Yahya. So even though his name sounds like it, he's not from northern Nigeria, but he's from Kenya. And he actually moved to Nigeria from Ethiopia. So he was from that side of Africa. And, those guys on that side are often a little suspicious about Nigeria. But this guy, Mo, is a big fan of Nigeria. So I'm really happy. He's now the UNDP Resident Representative for Nigeria, which means he's the UNDP Oga for Nigeria. And he's going to talk to us today about what the UNDP and other UN agencies are doing. So Mo, you came to Nigeria in September 2019, and I'm sure you had an agenda, you had a plan, and then all of this just probably got thrown out the window. So how is it going? How has your time in Nigeria been so far? And what was your initial plan to focus on?
Thank you very much for having me and give me the opportunity to share my perspective with you and your listeners. Yes, so I've been roughly in Nigeria now about a year. And as you said, for me, coming to Nigeria was a huge opportunity because you're coming to the Oga, Africa's Oga, as you say. This is where
at least he admitted it. Kenyans don't ever want to say that. Thank you. Okay.
It's an eternal beef we have between ourselves, Nigeria and Kenya. Anyway, well, let's go on.
No, we can't not like you because you give us music, culture, literature, everything. So we're on your side on this one. So when I came here really to Nigeria, the number one issue is, how do we get this giant of Africa to accelerate its development agenda and take the rest of us with you to the promised land, essentially. And looking at where Nigeria was on the SDGs, how can we accelerate? What was the financial gap that Nigeria needed to fund the SDGs? And that time, the gap was $350 billion for Nigeria to be able to reach the SDGs. So this is the kind of debate we were engaging with government, Ministry of Finance, Ministry of Planning, and across the board in the country, while also dealing with critical issues such as the conflict in the Northeast, and especially what do you do with reconstruction in the Northeast. Then COVID came out of nowhere, and we had to really reassess what to do, how to do it, how to support the country at this critical time. And Nigeria needed a lot of help, but Nigeria also responded. And I'm happy to go into it, but I'll let you come in. I mean, I don't know how you want to address, but I'm happy to tell you some of the things that we have been able to do, but also how the international community came together in a global solidarity to support Nigeria fight the pandemic.
All right, Mo, first of all, thanks to your organization, the UNDP, for what they do. So let's go to Nigeria's SDG 101. What's your initial assessment? How are we performing at this time?
So before COVID, Nigeria had a plan, and they knew they did their own assessment. The government did an assessment on the financial gap. What do you need to do to eliminate extreme poverty? What do you need to do? So there's 17 goals. With the last one being partnership, but 16 goals looking at the climate issue, gender equality, looking at issues around environment. So Nigeria was doing okay in one area, which was on the climate side, but was behind in several areas such as poverty. That's why President Buhari made removing 100 million out of poverty as a key criteria, because of the huge number of Nigerians still in extreme poverty. So, and there was a financial gap, so we knew how much that will cost. So now, after the COVID pandemic visited Nigeria, things are worse. Obviously, more people will be joining more people will be joined up, will become more poorer than they were. More young people will have more difficulty in finding jobs as businesses are impacted negatively. So overall, things are going to be much worse than they were. But I think this also provides Nigeria a huge opportunity to rethink, reimagine the kind of country you want to be, and accelerate faster than you have. I will come back later on some of the things that other countries have used. The crisis has been an opportunity for many countries to transform. I'll give you one example. It's because of the Spanish flu that the healthcare system was created. It's because of the Great Depression in the US that the welfare system was created. So huge opportunity for Nigeria to really reform because of what COVID has brought to the country and exposed.
Wow, thank you. And we should definitely dig into some of that deeper. But the next, so I mean, the purpose of this primarily is about COVID, right? Yeah. And so I know that the UNDP is kind of taking the lead on the international response here. So there's a lot to dig into, and we don't have that long. But just at a high level, maybe you can kick off, just at a high level, sort of the overall UNDP role and what you're doing, and then we'll dig into each of the initiatives a little deeper after.
So just to say first, we have about 19 UN agencies in Nigeria, because it's a huge country.
Wow. Okay,
so
19.
Okay. And UNDP is one among those. So we have been really playing a key role in terms of getting the UN system together under our resident coordinator, but also looking at what Nigeria needs. For example, procurement. Once the pandemic started, we've had many countries stopped exporting key medical items such as gowns, gloves, test kits. So the UN and UNDP use this global network to be able to essentially get Nigeria in the front of the line in getting those materials. For example, we've already brought in more than 300,000 test kits, millions of gloves, and gowns and PPEs. We doubled the ventilator capacity of the country. So a lot of materials were brought in, and with support specifically from the European Union, more than $24 million of medical equipments were brought in. So on the procurement side, where a specific country alone could not have gone and get those resources, the UN was able to use its network to get Nigeria the kind of medical equipment it needed. At the country level, we have a lot of WHO colleagues at the front line, and the UNDP supports overall UN response in helping the country build its laboratory capacity, in tracking and surveillance. And we've had a lot of UN staff, because we're in the front line, have actually been infected by COVID, and to sharing the burdens and the challenges the country faces. But also we do a lot of other things. For example, UNDP supports NCDC in analytics in terms of data. We do a lot of visualization. For example, we were able to tell how many people have been tested, how many people have become positive at the LGA level, so you can visually see it, so that policymakers, and when NCDC does presentations, they're able to show this. We have injected epidemiologists inside the NCDC to support the analytics and the tracing and tracking. So a lot of things the UN is doing across the board, and UNDP specifically, to support the response at the country level on the pandemic.
So a great deal of work is being done. So let's go into the specifics of the awareness. It's one thing to do so much. Is another thing for people, to be in the know, and for people to understand how that there is help out there, and how, you know. So let me ask you, how is the UNDP helping to drive COVID-19 awareness? Do you have any ongoing partnerships with the federal government or perhaps some state governments?
Yes, we work with NCDC again. NCDC has done a great job, and overall the Ministry of Health, in sharing information. But you also know that because of the nature of the way the world is today and the social media, there's a lot of misinformation. I can tell you, I spoke to Nigerians who don't even believe COVID exists because they've read it somewhere. So, and COVID is real. It's killing people. It's making a lot of Nigerians sick, a lot of Africans sick. We've lost more than 500,000 people globally to COVID. This is a real issue. So one of the things we have done is to get trusted voices across Nigeria, specifically in the Nollywood, Kennywood, musicians and others, to go onto television clips, on social media, and tell people these things are real and we need to do much more. Currently, through the UN Basket Fund that UNDP manages, we've invested 8 million in risk communication to go to the rural level, to go to community level, to go to the urban poor, to explain how this virus works and how many people can do what they call non-pharmaceutical intervention, basic things such as washing your hands, socially distancing. And I understand, and I'm very, in African context and in Nigeria, that is not necessarily easy for people to social distance. I learned when I was in Lagos, I learned where we call them shanty towns. In East Africa here, you call them I face you, you face me, kind of houses, where the social distancing becomes that much more difficult. So this is a reality, and one of the things I say all the time is COVID has exposed our weaknesses. COVID has exposed our unfinished business in development, but communities and others can do much more to protect themselves. And this is what UNDP is doing through partnership with Nollywood actors, creative industry, musicians, to share those information.
Wow, that's amazing. And I assume it's all in local languages and all that as well, correct?
Absolutely. We have in Pidgin, in Hausa, in Yoruba, in Igbo, in several other minority languages across the country.
Okay, well, when you need the next one in Hausa, let me know. I'll do it for you. So, okay, but let's go on. So, UNDP, I believe, is also involved with the COVID-19 Presidential Task Force. What role do you have there?
So, one thing that the government did early on, and it doesn't get enough credit, is the setting up of this multi-sectorial presidential task force. Okay. With an understanding that this is a health crisis, but it's also socioeconomic and security crisis. Right. So when you close people down, you are impacting on the socioeconomic activities, specifically when you have majority of people in the informal sector. So the task force is set. It has the security services. It has ministers across the government. It has others. So what we do is to provide technical support across the working groups on resource mobilization, on knowing where the resources are going, building a dashboard for them to see who's pledging what. We've also supported on many aspects, including the management of the basket fund. I will come back to that hopefully if you give me an opportunity later. Is this multi-million-dollar basket fund that's over 65 million now, roughly, dollars. You have a representative of the presidential task force sitting there saying, this is the priority for government. Mm-hmm. This is the where the money should go. So that is also some of the things we're doing. All the allocations have been done with the blessing of the presidential task force.
Just in case you're just joining us, we are talking about the international communities. Pardon me, I just lost my line of thought there because of some intrusion. We're talking about the international community support to fight COVID-19. And we're having this conversation with the United Nations Development Programme's resident representative in Nigeria, Mohamed Yahya, whom we fondly call Mo. So you asked for an opportunity to get back to this basket fund. Here's one. So the UNDP is managing that basket fund for COVID-19 for Nigeria. I would like to know who the contributors to this fund are and how it works and how it can be how people can access it.
So thanks. The basket fund was set up because it was a realization that government financing alone will not be sufficient. And also realization that the private sector has also put a lot of money outside. So we set up the basket fund to complement government resources, but also private sector resources. So who funds it? One of the key funders who put 50 million euros is the European Union.
Okay.
And European Union, I mean, when I engaged with Ambassador Ketil in Abuja, one of his early proclamation was, this is the time for global solidarity. And if COVID is not defeated in Africa or in Nigeria, it will not be defeated anywhere else. So there's that understanding. So EU is one. Aliko Dangote Foundation put about $4 million.
Okay.
We have Gates Foundation who put about $1 million. We're finalizing one MacArthur Foundation. We have the government of Switzerland. The UN itself put 2.2 million. So together, roughly, we will by next week it will be about $65 million. And for your viewers, how those resources, to understand how the resources are allocated, we have a project board that has the partners, the government, and chaired by the UN resident coordinator. And then proposals are brought from the PTF level, comes to us and says, this is what we want to do. For example, we need to do more on community risk communication. So how do we do that? That is discussed and resources are allocated. For example, for community risk communication, for communities to understand the risk of COVID, $8 million were allocated. $24 million were allocated for procurement of resources, medical equipment. Resources were allocated for surveillance to follow across people who have got in contact with somebody who may have had COVID. So that's the way it operates. It's been very successful. More than $41 million have already been allocated through the UN agencies plus their partners at the community level. And that is the way the basket fund is working. And I say it complements everything else that is ongoing.
Right. Okay. So let's go to the next. I mean, you mentioned this also earlier about helping Nigeria access some of the medical equipment, ventilators, testing, and all that. So how exactly does that process work? I mean, the UN, what did you do? You went and called these big companies and said, look, you got to help Nigeria, or was this like a global effort and then every country got a bit of what was able to be procured? How did that work exactly? I'm
gonna pretend nobody's listening, and I'll tell you how it works. Because
yes, exactly. Nobody listens to Nigeria Info. Don't worry, nobody listens.
I don't want others to jump the queue the way we've been helping Nigeria to jump the queue.
Okay. So all right, we'll keep it. Yeah.
There's two ways we do it. One, there's a global pool of medical equipment through WHO and UNICEF in Copenhagen, where you go and apply and you'll get. But everybody's applying, and some of the equipment have come through that way. The other way we have done is we have offices. UNDP has offices in all these countries that use this medical equipment, such as China. So I call my counterpart in China, and I tell him, find supplier for A, B, C, D. So we go straight to the suppliers. He puts it in a plane, and it lands in Abuja. So we've been able to do that several times. So we've got the ventilators, test kits, and so many other equipment just straight going to the suppliers and competing with the rest of the world, and to bring Nigeria the needed material. So that's the way we've done, and we will continue to do. Just to say, in 2 weeks, we will bring a full plane of PPEs for medical workers in the front line that the government had requested that we bring. So that is some of the way we've been able to procure these goods.
So let's talk about vaccines specifically and availability. Massive strides are being made to this end. And the rest of the world is just waiting, like kids, waiting for mama to be done in the kitchen. There is a concern, however, that when these vaccines are ready, developing countries and areas like Africa may be the last on the queue. So how will the UN ensure equal distribution of vaccines to developing countries like Nigeria and across Africa?
Well, Mo will just call his friends in China, I guess.
No, so don't share my tricks. It's too soon. But no, but I was going to say, but honest truth, what we've seen in the past, I don't know if you follow this H1N1 outbreak.
Yes.
Before. And they had vaccines, and the vaccines that were said, what the governments that produced that will I will not mention their names. I work for all governments in the world, but in this specific country, I'm interested in supporting Nigeria, obviously. But one thing we've seen in other countries is what they call vaccine nationalism.
Yes.
A country that produces it blocks it and said nobody can export it. We need it in our country. So that is a big worry for the UN. You know, the UN was set up precisely to do things in crisis, such as now, and pandemics and other things. So one of the things the WHO and its partners have done is to create something called Access and set up a team that will look in ensuring that when vaccines come, they are distributed equitably across the world.
Okay.
So that's some of the things we will be pushing, and we'll be pushing to ensure countries that do not have the capability to have these vaccines are able to access them. It will not be easy. We have seen one of the things that worries us is another form of vaccine nationalism. But the sooner this partnership goes, that's already underway, we hope to be able to provide countries who do not produce them as soon as possible, especially for countries that are least developed.
Okay. Well, I think Nigeria is lucky because we have Mo Yahya who's there fighting for us. So thank you for that.
There's no vaccine. You bring me back here to ask me where is it.
Okay. Yeah. No, but you know, interestingly, a couple of 100 years ago, there was something similar with the quinine when quinine was discovered as a remedy for malaria. It was the bark of the tree. And there was like James Bond operations to sneak into South America and steal the bar. I mean, it was crazy. So we might have more of that. But is a lot of the what has happened is countries have closed borders, and a lot of the responses are very insular. My country versus your country. But the UNDP is obviously a multilateral body. Are you also coordinating some kind of regional response? I mean, is there cooperation among UNDP offices across West Africa, maybe across the continent?
Just to give you one of the things we've done at UNDP Nigeria is to also get medical supplies for ECOWAS. So
I see. Okay.
About they paid for it. We went and got them access about 6.5 million of ventilators, test kits, 200,000 test kits for ECOWAS.
Wow. Okay.
I think the realization is, although the world has responded to COVID from a nationalistic perspective, this virus doesn't care about the clothes you wear, the color of your skin, the language you speak, and it sees no border. So the response that the UN has been pushing through the WHO coordination has been this need a global solidarity, a global way of focusing on this. So from a UNDP perspective, we've been supporting ECOWAS. We are working with the African CDC with data analysis. And just to say, the biggest challenge of COVID is not the disease itself, which sooner or later we will have vaccine, and I think governments will do much better in coordinating, but is the economic and social ravage that is left, and that will also demand. It will be much longer on how we recover. As I say, be more hunger, more poverty, more underdeveloped, more inequality immediately after COVID or even during COVID. How we respond regionally will be even more important than the fighting the disease itself.
All right. Mo, we've got to let you go, but this is the final question, and you already touched on it, recovery. I was just going to ask you, post this COVID-19 situation, as we come out of the pandemic, how? You've already said much will depend on how we recover, but how do you see us recovering better and building back? What types of policies in line with global efforts will the UNDP be recommending for countries like Nigeria? That is the $1 trillion naira question, because really I think and what COVID had exposed are the realities of that Nigeria's healthcare system was not ready to fight a pandemic. COVID exposed over-reliance on one commodity to support your budget, oil, that fluctuates whenever the world goes to economic recession. COVID has exposed the level of inequality. Those urban poor are not able to socially distance, for example. COVID has exposed a lot of things, but opportunity that COVID provides is not to go back to the past. We cannot reimagine the past. We have to go up front, and Nigeria needs to be able to do reforms that it has put on the shelf for too long. Public sector reforms, diversifying the economy, revisiting the social contract. How do you want to live with each other? And I think COVID and the extremity that COVID will bring in terms of economic impact offers you that opportunity to think a better future. And countries that have done so in every crisis have proven to be the countries that have prospered. Korea
was poorer than Nigeria in the 1970s. South Korea. Korea now is a first world country. What did it do? It used the Korean conflict and the devastation of the Korean conflict to reimagine its future, to rebuild better. We can go example after example: Singapore, Malaysia, Indonesia. We now, as Africans, and especially Nigeria as the leader in this continent, we cannot go back to the past. We cannot have a situation where 70% of the budget is oil. So this is the opportunity for this country to unleash its dynamic people. And from the UNDP side, we'll be with you to support you all the way to ensure this country's promise. And it's not surprised that COVID has happened in 60 years after your independence. We are celebrating 60 years. 60 years is very young. This is the opportunity for this country to leapfrog. And I think this is a big realization, talking to many of your ministers across the board. There's a sense that this is the time for Nigeria to fly. And I think the opportunities are there. And this is the kind of debate we want to be able to enter.
Mohamed Yahya, great guy, the United Nations Development Programme's resident representative in Nigeria. Awesome on the show today. You are a hero. Thank you for all you're doing for the continent and for Nigeria, despite our perpetual beef, which we will settle at other times. Thank you. We love you, man.
Thank you very much. I just want to finish to say this is one of the greatest country, and this country will find its destiny, and I am sure of it. Thank you for having me.
Pleasure.
Thank you so much. Thank you so much, Mo. And I love your Pan-African view. And you're already Nigerian enough that he said Naira instead of shillings. So we know you're on board. And I'm glad you're the guy that's fighting for Nigeria. So thank you so much, Mo. Thank you for coming on. I know you're very busy. And just have a great rest of your week.
Thank you very much. Take care, guys. Thank you.
All right, thanks.
Wiebe Boer and I will return same time next week. Until then, have a wonderful day and please be safe.